Hi, my name is Orchid and this is my basic physical assessment for Nursing 604. Here's my patient, her name is Sharon, and just to let you know that before I came into the room, we had the CNAs take her vitals, her height and weight, and do a Snellen vision chart on her. So her vital signs are stable, her height and weight is appropriate for BMI, and her Snellen chart, she had a 20/20 for her vision exam. When I first come into the room, I did already introduce myself to our patient. I also washed my hands. I made sure that we have adequate lighting. We have good privacy as well. When I look at her, she is well groomed. She has, her height and weight looks exactly like it does in the charts. She appears to be in no distress. As I talk to her, I find out that she's alert and oriented ×4. When I also look at her, I also see that there's no abnormal facial abnormalities or any abnormal hair distribution, and I just kind of look her up and down. So I'm going to go into my assessment. First, I'm going to go look at her head. So when I look at her hair, I'm looking for any lice, mites, any lesions, any bumps, anything that might stick out to me, any rashes, and I don't see anything, so those are good. I'm also looking at her face. As I said earlier, her face has no abnormal deviations. I'm going to check her cranial nerves. So I just want to see if she can move her head towards my hand. Okay, good. Move my head towards my other hand. Very good. As I touch her skin too, I notice that her skin is nice, warm, and dry. And I look at her hands. I'm going to do a skin trigger test. There's no tenting, so that means she has good. She's well hydrated. I look at her nails. Her nails, the shape, contour, and condition of them are nice. She's also well groomed, so which makes it even better. I'm gonna do a cap refill while I'm here, and it's less than 3 seconds, so it's perfectly normal. I'm also gonna, since I'm doing the face as well, I'm gonna ask her to do cranial nerve number 7 check. So I'm gonna have her puff out her cheeks. Okay, good. Smile for me and show me her teeth. Go ahead, close your eyes real tight. Don't let me open them. Okay, good. Go ahead and raise your eyebrows. Okay, good. Relax. Okay, so those are all within normal range. I'm going to check her cranial nerve number 5. So it's the transmandibular joint. So I'm going to go here. Okay, so go ahead, clench your teeth. Okay, relax. Open your mouth. Okay, now close your mouth. Okay, good. And there's no tenderness, right?
No.
Okay, so there's no tenderness there. So her cranial nerve number 5 as well. Well, since we're at the mouth, I'm going to do the mouth. So go ahead and open your mouth. Okay, say ah. Okay, I'm looking for, okay, that's enough. I'm looking for her uvula and soft palate rise and fall. So that's another cranial nerve. Go ahead and stick out your tongue. Okay, move it left and right and up and down. Okay, that's good. So her cranial nerve number 12 is good. I would normally gag, well, I wouldn't gag a patient, but unless I really have to. But for the purposes of this video, I'm going to pretend that I gag her and that her cranial nerve number 10 is within normal. So she has gag reflex. I'm also going to have her shrug her shoulders, which is cranial nerve number 11. Go ahead, shrug your shoulders. Okay, good. Okay, so next we'll go into her nose. So I'm looking at the outside of her nose. Her nose looks good. There's no redness, no nasal dripping. There's no sneezing. I haven't noticed her sneeze or any sniffling either. That's the outside of the nose. Next, I'm going to go look at the inside of her nose. I'm going to be looking for her nasal mucosa and her turbinate. All right, so, and for the purpose, for the purpose of this test, for this video, I'm only going to do one side of her body. I'm not going to do both sides, but in reality, I would do both sides. Okay, so I'm going to do your left nostril and just relax. And since I'm also looking at her, I'm also looking at her septum deviation to see if there's anything there. And actually, before we go ahead and do the test, can you go ahead? I want to check the patency. Put your finger on one side of the nose and breathe in. Okay, now do it on the other side. Okay, good. Okay, so now I'm going to put the thing in your nose. Okay, ready? Okay, nasal mucosa is good. Her turbinate looks good. I don't see any swelling or any extra nasal drainage in there either. Next we're going to do is test the sensory. I have a essential oil. So I'm going to have Sharon close her eyes and go ahead and take a smell. Let me know what it smells like.
Lemon.
Okay, it smells like lemon, and it is lemon. So her sensory cranial nerve number 1 is intact. Next, we're going to go to the eyes. The external of the eyes looks good. I haven't seen any like lazy eye or anything like that so far. Sorry. And the external of the eye looks great. I don't see any drainage. I don't see any exodus coming out of it. Sharon, I'm going to pull down your eyelids, okay? I'm going to look at the inner conjunctiva, or the conjunctiva, which is nice and pink, which is normal. Her sclera is white. There's no jaundice. There's no redness to those either. Her iris and her pupils are nice and round. All right, Sharon, what I'm going to do, oh, and by the way, for cranial nerve number 2, we already did the Snellen test outside, but I'm going to test her peripheral vision now. So Sharon, go ahead, look forward, and when you see my hands, you let me know.
Yes, I see it.
Okay, so her vision, her peripheral vision is intact. So next we're going to do Perla, which is I'm going to shine some light in her eyes. All right, so I want you to go ahead and look at me, and what I'm going to do, I'm going to close one eye and actually shine it, and when I see your pupils react, then I know that that's normal. Okay, okay, that one's good. Good, and they both are equal and reactive to light. And next one we're going to do is accommodation, so go ahead, look at my pen. Okay, so her eyes accommodate very well. Next we're also going to do cranial nerves number 3, 4, and 6. Okay, so go ahead, follow my pen. Actually, this way. Okay, good. So those are nicely and intact. Next we're going to do the ears. So the outside of her, actually I'm going to come on this side. The outside of her ear, so Sharon, if you could face this way just a little bit. Yeah. So the outside of her ears look normal. They both look symmetrical on both sides. Her pinna looks good as well. I don't see any drainage from her ear or any lumps or mites. Lumps or any bugs as well. So next I'm going to look into her ear. So let's go ahead and clean this off real quick. Okay. So when I look into the ear, I'm looking for the I'm trying to visualize the tympanic membrane, and note any extra earwax in there too. Okay, you ready?
Mm-hmm.
I'm gonna pull her pinna up and back. Okay, I can see it. If you can visualize it, it looks good. I don't see any extra earwax or anything like that. It's nice and pearly gray. Okay. All right, next I'm going to do a hearing test. First I'm going to do the Wiener-Weber test. So the Weber test, I'm going to vibrate it, and I'm going to put this on your forehead. You let me know if you can hear it right side, left side, or middle, okay?
I hear it in the middle.
Okay, good. The next test we're going to do is the Rhine test. This one involves the fork going in the stem going at the back of your mastoid. I'm going to touch it to the back of your mastoid. You let me know when you stop hearing it. And then next I'm going to bring it to the fork end to your ear. Let me know when you stop hearing it, okay?
Okay.
First off, is your mastoid, are they getting tender?
No.
Okay. I'm going to go on this side so it's a little bit easier for you guys to see me. There we go.
Okay, stop hearing it. Okay, stop hearing it.
Okay, so the air conduction is twice as long as the bone conduction, which is what we want. So her hearing in that aspect is really good. Next, I'm going to test for her actual hearing. So go ahead and cover your right ear. Your right ear?
No.
I'm going to close your eyes, and I'm going to whisper a sound to you, okay? And you just repeat what I say.
805.
Okay, good. Now go ahead, switch ears. Okay, this side I'm going to say
Ventura.
Okay, good. So her hearing is good as well. So you could go ahead, open your eyes. Okay, so we've done the eyes, the nose, the mouth, the ears. Now we're going to go to the neck. Her neck area, her neck is symmetrical. I don't see any large bumps or anything, or any scarring in this area that might show me a thyroidectomy or anything like that. So I'm going to go ahead and feel for her lymph nodes. Okay. You let me know if you feel any tenderness at all.
No.
also check her thyroid, so, okay, go ahead and swallow. Okay, good, so that one's fine in this area. I also look at her clavicle area. I don't see any clavicle deviations or any signs of previous broken clavicles. I'm also looking at her chest now. Her chests are symmetrical, rise and fall of that. I'm also going to go ahead and listen to her as well. But right now, as I look at her and look at her anterior posterior diameter, she doesn't have any barrel chesting or any pigeon chesting, so that's good in that aspect. When I look at her back, I don't see any scoliosis or any kyphosis that stick out to me. So Sharon, I'm going to listen to your lungs, and every time I put my stethoscope on your chest, I'm going to have you take a deep breath, okay, in and out. But also for the purpose of this video, I'm just going to show you where they are. We're not going to truly go into the whole breathing in and out. You ready?
Yes.
Okay. That's 1, 2, 3, 4, 5, 6. And then we'll go to the sides as well. Okay, good. So those are clear, no rails, no crackles, no rhonchi, no wheezing as well, or any appetitious sounds. I'm also going to go ahead and listen to the back just to double check. So Sharon, if you could face this, actually, yeah, if you could face your back towards the camera, so actually you can go a little bit more. Okay, that's good. Okay, so again, I'm going to do the same thing, but each time I touch the back, normally I would have the patient breathe in all the way, but in this, for the purpose of this video, we're just going to go real quick. Okay, so 1, 2, 3, 4, 5, 6, 7, 8. And we'll throw in the sides for the heck of it. Okay. So again, I don't hear any adventitious sounds. She sounds nice and clear. The next we're going to do is lung excursion tests. So I'm going to see if they're symmetrical when she breathes in. So go ahead and breathe in. And breathe out. Okay, so that one is symmetrical, so that one's within normal range. Next I'm going to do the diaphragm excursion. So Sharon, I want you to breathe all the way out, and what I'm going to do is tap on your chest, okay? Or tap on your back. So go ahead, breathe all the way out. Okay, so it's right there. So go ahead, breathe in. Okay, so we're right there. Okay, so we're looking about 3 centimeters. Go ahead, breathe normal. And anywhere between 3 to 5 centimeters is normal. Okay, that one's normal. Next, we're going to do the tactile fremitus. Here we're going to have her say 99 as I put my hands on her chest or her back. So say 99.
99.
Again.
99.
Okay.
99. 99.
Okay, good. Now turn to the front. We'll also do it in the front too. So go ahead, do it again.
99. 99. 99. 99.
Okay. So I don't feel anything. I don't feel any pleural effusion, any fluid in the lungs, or any lung masses like that. So next we'll go into, and also I don't notice any cyanosis on her, so I know that her breathing is good. And same thing with her vitals. Her O2 sat was within normal range as well. So we're going to go into the cardiac portion. So this time I'm going to use my stethoscope again. I'm going to use both the bell and the diaphragm and the bell. And the diaphragm lets me listen to S1 and S2. The bell lets me listen to S3 and 4. Okay? Okay, so here's the aortic, pulmonic, herbs, tricuspid, and the mitral valve. Now the mitral valve, the mitral point is also your point of maximal impulse, and it sounds very normal, nothing significant. I'm going to do the same thing with the bell now. So aortic, pulmonic, herbs, and then tricuspid, and then the mitral valve. So no galps, no murmurs, or anything of that nature. Next I'm going to check her pulses. So I'm going to check her radial pulses. The rate is within normal rhythm. Check her cap refill at the same time, since I did that earlier, but we'll just do it again. They're instantaneous, less than 3 seconds. I'm going to check her feet too. Her pulses on her dorsalis pedis, and those are within normal range as well. Let's see, what else? Next, we're going to go into the abdomen section. Oh, Brits. Hold on, let me listen to her Brits real quick. So I'm going to listen to her carotid Brit 1 here. Okay. So yeah, I don't hear anything. Okay, we're also going to go to the abdomen birds as well. So here's the aortic, the renal. Okay, I don't hear anything there. Go ahead, lift up your hand. Iliac, and then femoral. Okay, those sound fine. Next, we're going to go into the abdomen, so I'll have you go ahead, lay down on the table. Okay, you can put your knees up if that's more comfortable for you. Okay, for the abdomen, I'm going to inspect her abdomen first, so go ahead, lift up your shirt a little bit and pull down your pants just a tad. Okay, just enough. And I don't see any obvious scarring or any bulges or masses or anything like that. Sharon, can you go ahead and lift your head a little bit? Okay, that's good. I don't see any hernias that appear as well. Next, I'm going to listen to her. So I'm going to listen to her quadrants to see if there's bowel sounds. And she's got good bowel sounds. And since she's laying down, I'm going to listen to her iliac and femoral birds as well, since she was sitting earlier. So yeah, those are normal as well. Okay, go ahead. I'm going to go ahead next. I'm going to push on her belly. So if you want to, you can pull your pants back up and your shirt down. But next, I'm going to push on her abdomen. I'm going to look at her face, see if she's having any guarding. But at the same time, if you feel any tenderness, do let me know. Okay. Okay, what I'm looking for is any abnormal masses. Okay, and I don't feel anything. Okay, so that's good. Next, I'm going to percuss her stomach, and I should hear tympanic sounds throughout. Okay, and they all sound very well in tympanic. Next, I'm going to check the range of motions for her feet and her legs. So go ahead, bend up one knee for me. Okay, so go ahead, push against my hand. Okay, very well. As you're here, I'm going to have you bend your knee again. Extend your knee. Okay, back down. And then put your foot down. Okay, go ahead and adduct your knee. No, go ahead, bend it. Adduct. Okay, that one feels good. I don't feel any clicking or any hips or movements or anything like that. Go ahead, extend your leg. And what I'm going to have her do is invert your feet, so like this.
Oh,
okay,
yes.
That one's good. And then inversion and eversion. And those are all good in that respect. Go ahead, sit up. And that was a little bit of range of motion right there since she was sitting up first. Next, we're going to do some neurovascular checks. Since I've already started the range of motions, I might as well just keep going. What I'm going to have you do is bring your arms out in front of you. Okay. Bring them out to the side. Okay, that looks good. Bring it out front, up. Okay, good. Now I want you to do kind of like around the world. There you go. And what I want you to do is come up and back behind your, yeah, good. And come down and back behind your head. Okay, very good. And back down. Okay, good. So her shoulders and her arms are working well. Same thing with her back. Next, we're going to do neurovascular checks. So I want to do your your deep tendon reflexes. So first I'm going to check her tricep reflex. So Sharon, give me your arm. Relax your arm. Okay, relax. Okay, ready? 1, 2, 3. Okay, that one looks good. Next is the brachial reflex. Ready? 1, 2, 3. Okay. And next is the brachioradialis. 1, 2, 3. Okay, good. Next is going to be her patellar reflex, and I'm going to just use my hand for this one. Okay. Okay, next is going to be the Achilles. Okay, relax your leg.
Okay.
Okay, 1, 2. Okay. Next is going to be the Babinski one, or the plantar. Okay, So her feet kind of go inwards. If they were to fan, that'd be abnormal for an adult. Next would be your sharp and dull sensations. See if you react to those. Okay. So yeah, I'm actually gonna show you what it looks like first. Okay.
Okay.
So this is gonna be dull.
Okay.
Okay. And then this is gonna be sharp.
Okay.
Okay. So go ahead, close your eyes. Okay, you ready?
Dull,
Okay.
sharp, dull, sharp, dull, sharp.
Okay, go ahead, open your eyes. So those are intact as well. Next, we're gonna do some cerebellar function, testing. First, what I want you to do is put your finger to your nose, and then go ahead and reach out to my finger and go as fast as you can. There you go. Very good. Okay, relax. Okay, next I'm gonna have you do some rapid alternating movements. So front and back like this. Very well done. Okay, next I'm going to have you take your heel and just basically graze your shin on one side, up and down. There you go. Very good. Okay, since we're also sitting, I'm also going to do some vibration sensations as well. Just a few of these. Okay, so you let me know if you can feel it, okay?
Okay.
You feel that?
Yes, I feel it.
How about that?
Yes, I felt it.
And that?
Yes. Yes.
Okay, so she could feel the sensations in her vibrations of her thing. Next, we're going to have you do the Romper test. So go ahead, stand up. Okay, so when she stands up, I know she has a steady gait, but I'm going to be standing here just in case and then I'm going to have her close her eyes and see if she could balance. And she's doing a good job balancing. Okay, go ahead, open your eyes. Okay, so next I'm going to check her gait out. So Sharon, I'm going to have you walk to that door behind you over there, just the normal walking. And then when you get to the door, stop and turn around, come back to me and walk on your toes towards me. Okay, and then when you get to me, stop. When you turn around, go ahead, walk on your heels back to the door. Okay, very good. Yeah, stop. Okay, stop for a second. When you come back this way, I'm going to have you do a tandem jump. So that's a heel toe, heel toe. Okay. Okay, very well done. Okay, now I'm going to have you do a shallow knee bend. So go ahead, just do a gentle shallow knee bend. Very wonderful. And next I'm going to have you reach down and try to touch your toes. Okay, now here I also feel her back too, and I don't feel any scoliosis or kyphosis. Okay, go ahead, step back up. Alright, and so this concludes my physical assessment, basic physical assessment. I appreciate you watching me.